This segment is sponsored by VCU Health.
The doctor is in and you have questions. The risk for severe illness with COVID-19 increases with age and puts older adults at the highest risk category. Dr. Christian Bergman, a specialist in the Division of Geriatric Medicine at VCU Health Center for Advanced Health Management right here in Richmond, is with us to share more about what it means for viewers 65 or better and those caring for mom and dad. It's great to see you this morning, Doctor. Thank you.
Glad to be with you. Thank you so much.
This is such an important conversation. And as I've said often, we're going through this together, but in such unique ways. Age is one of those considerations, certainly. And, COVID-19 is impacting different age categories in different ways, isn't it?
It certainly is. Thanks you so much for raising this important topic. We know that the risk of COVID-19 poor outcomes increases with age. CDC has said that 8 out of 10 deaths in the United States due to COVID-19 has been in older adults. And it is worthwhile pointing out that the nursing home population has been devastated, during this pandemic. And it's so important to understand that the nursing home population only comprises 0.5% of the U.S. population, yet we have had 125,000 deaths in this population. So 1 out of 4 deaths in this country are in nursing home residents. And so we're doing everything we can to help support these older adults in our community.
Dr. Bergman, with those of us who have loved ones in this 65 or better category, it certainly is sobering to hear those statistics. What offerings of hope do you have for us today?
We have learned so much throughout this pandemic about the importance of public health. Multiple people, even from our own state department and our own specialists in infectious disease, have continued to emphasize, wearing a mask, washing your hands, watching your distance, physical distance or social distancing. Those are key messages. But for older adults, also important to not forget about managing chronic diseases, going to see the doctor, going to seek help when you need it. And lastly, the vaccination, the success story from Operation Warp Speed and being able to deliver a vaccine in under a year is really great hope. And we look forward to the future and being able to do that.
Let's talk a little bit more about the vaccine. You've received it. What do you share with your patients and with the 65 or better age group in terms of what you experienced?
Yeah, thank you so much. We have followed these clinical trials data and everything about the vaccine over the last 6 months or so. And I received the vaccine. I had a sore arm. I had felt a little, fatigued maybe the next day or so. Went away, by day 2, 3. And I think the second shot I had was a little bit more soreness in the arm. But otherwise, I'm excited that older adults are getting the vaccine when it becomes available to them. We know it's safe and effective. We are excited that almost 35 million Americans have now been vaccinated with at least 1 dose. And we understand that people are scared. I was nervous, but I feel safe now that I have the vaccine, and I will continue to wear a mask and do everything I can to minimize my risk.
Doctor, it's so important to have these conversations and to learn about experiences just like yours, and that you're sharing that with your patients. Overall, what is VCU Health doing a little differently to help this patient population of 65 and better?
Yeah, thank you. VCU Health has been developing a slew of services across the care continuum. We have clinics that have telehealth options. We have home-based primary care. We have nursing facility attendings and nurse practitioners and physician assistants, and we have a hospital-based program. And so we are taking good care of older adults within the care continuum wherever they are, and we are focusing our vaccination efforts on those at highest risk over the age of 75.
It sounds like some very important and considerate considerations have been made for this special group. Thank you so much, Doctor, for being with us.
Thank you so much. I appreciate it.
Absolutely. And we'll share more information right now so that you can learn more about the VCU Health Center for Advanced Health Management. Visit vcuhealth.org/CA.